Hello everyone, good evening. Welcome back to my channel Healing with Heena to day 2 of this live session of study of Ellen's Keynote. And thank you so much for your response, overwhelming response on this first session. And I'm really glad to know that all you are really very enthusiastic to learn Ellen's Keynote and to join this live session. So thank you so much for all your messages, mails. And earlier I had planned of doing this session alternate days, but after reading all your messages and comments, I've decided to do it like every day so we can complete this Ellen's Keynote uh, as soon as possible. Okay. So welcome to all those who are joining now. So first day we have completed abrotanum, and I hope you still remember what we have read day before yesterday. And reading materia medica is something you need frequent revision of it, you need frequent discussion. Only reading it once and leaving is not enough. So what you need is a discussion. Discussion is very important. That day we read about abrotanum. Since we have completed only one medicine, so just to show you one example how you should read Ellen's Keynote basically, and to remember it for a longer period. If you have read, like, after we finish like 4-5 remedies from Ellen's Keynote, what you can do among yourself with your friends and all, you can do this way, that go to any remedies, which 5 remedies suppose we have completed. So go to any of one of the 5 remedies, and from there you randomly pick up any line, give the book to one. Like, suppose I am two of us are discussing, and I'll take this Ellen's Keynote, and randomly from anywhere I'll ask you one line, and you have to answer in which medicine that line is given. Okay, so this is a sort of a game. This way you can discuss different remedies given in Ellen's Keynote, and remember it for longer duration. So ask me Ellen's Keynote is the best game which homeopaths can play amongst themselves whenever they have time. So, and this is very helpful if you're getting bored, or if you don't have much to do means other than social media, of course. So what I feel is this is the best thing you can do, and that will be helpful everywhere, in exam, in practice, in life. So this way you should read Ellen's Keynote. Okay, now as none of you are saying anything, I think we should proceed to next remedy. Okay, whoever have joined this session, can you please tell me your name or say something, so that I'll be assured that I'm audible, I'm visible, and we are good to go. If you can, please. Okay, hello Adiba. Okay, so Dr. Mahavir Singhal. Hi Mahavir, Dr. Mahavir. Yeah, okay. So let's start with today's remedy. I hope abrotanum you will remember. We'll take a surprise test Okay, hi Dr. Ranjit. Okay, so let's get started. Thank you so much. Okay, so today we are going to read about acetic acid. So whenever you read any medicine, any remedy, and especially when you are reading it for first time, if you are a UG student, a BHMS student, you should know what it is. Like when you read acetic acid, so you should know what is acetic acid, from what is the source of this, है ना? From which it has taken and this medicine has been prepared. You should have the basic idea about this. So what is acetic acid? Acetic acid is present in cider vinegar, in everyday life we apple cider vinegar and all this we hear. So that cider vinegar, it contains this acetic acid. So from there this medicine has been prepared. So acetic acid, and the common name is glacial acetic acid. Okay, so from which part is used to make acetic acid? Can anyone answer me? Part we answer in different medicines na ki this part is used to make this medicine. So for making acetic acid, which part is used? Anyone would like to answer? No one. Okay, so it means no one knows the answer or no one wants to answer. Okay, so I am assuming that no one knows the answer. Okay, so which part is used to make acetic acid? The question was absolutely wrong because acetic acid is not does not belong to vegetable kingdom, and as it belongs, as it is, the name is suggesting it is an acid, so it belongs to mineral kingdom. And the medicines which are prepared, there are three basically. The medicine, the sources are three: animal, mineral and plant, right? Vegetable. So the medicines which are prepared from vegetable kingdom or plant, the source is plant. uh, for those medicines only, the question is asked which part is used, because plant has different part like the leaves, stem, bark, roots, all this. So as we are discussing a mineral remedy, we are discussing an acid. So the question is not valid here which part is used, the acid itself is used. So cider vinegar, that is acetic acid. Okay, so no one said that I'm asking a wrong question, and I ask it deliberately. Okay, so it is a glacial acetic acid, and it was proved, it is not written here, so you can note it down that it was proved by Barrett, and but it was introduced by Herring. It was introduced into mathematical by Herring, but it was proved by Barrett. Okay, and whenever you study any medicine which belong to plant kingdom or vegetable kingdom, you should know which family it belongs. Okay, so there are different families to which this medicine belong. But when you are reading a mineral kingdom remedy, you should know the formula, okay, of that remedy. So acetic acid, the formula is C4H3O3. So you should remember the formula. It is proved by Barrett, but it was introduced by Herring. The common name is glacial acetic acid. And for your exam purpose, for this MCQ, it belongs in the pharmacy MCQ, that it belongs to which class? Class 5A. 5A is which are the medicines which are soluble, easily soluble in alcohol. So it belongs to class 5A. Okay, so this is the basic information about acetic acid. Okay, so further it goes this way, that acetic acid is adapted to pale, lean persons with lax, flabby muscles. Face is pale and waxy. In bracket, ferrum metallicum. Okay, so remember, whenever any acid, you're reading any acid, generally or usually all acids have this type of description only. They are lean, thin, they are pale, they are very weak. Okay, so uh, same way acetic acid is adapted to all those persons who are pale. Pale means what? You must know that pallor is present, that they are very pale, maybe because of lack of less of hemoglobin, or because they are anemic. So they can be pale, they are very lean, and they have a lax and flabby muscles. Flabby muscles which hangs loose. Muscles when you exercise, your muscles get toned, like the it is attached to. Yeah, 5A is soluble in water. Yes, right, Ranjit, right. It is soluble. Okay, thank you, Dr. Bina. Let's focus on Ellen's keynote. Okay, so yeah, right, very good. Means you all are very attentive. So yeah, it is soluble in water and not in alcohol. Okay, 5A. So this is important. You should not take it the way I am giving you. You should cross check it if it is right, wrong, and you should be very attentive. So I'm happy. So yeah, what I was saying, muscles are flabby. Flabby muscles means what? When you exercise, the muscles are in close this proximity with your bone. Okay, so muscles are very close to your bone and they look very toned. But when the muscles are flabby, they lose hang. Like when you walk, the muscles are very. It looks not very toned. They are very flabby. So flabby muscles, face is pale and it is waxy. Okay, waxy means wax. If wax is applied somewhere, how it will appear? It will appear very shiny, and so bracket ferrum metallicum is given. So yeah, MCQ. Now MCQ here comes, adapted to pale lean persons. This cannot be asked, but face is pale and waxy. These two words can be asked. Okay, these two words can be asked as MCQ, and you should know answer is acetic acid. Okay, so now hemorrhage means bleeding from every mucous outlet. This is also another feature of every acidic remedy, acid remedy. So hemorrhage from every mucous outlet. Like mucous outlet means what are the outlets? Like nose, throat, lungs, stomach, bowels, uterus. Okay, and in bracket ferrum metallicum and millefolium is given. Then metorrhagia, vicarious, and traumatic epistaxis. In bracket arnica is given. So you should know there will be bleeding. Bleeding from where? From all the mucous outlet. So there can be bleeding from nose, that is epistaxis. There can be bleeding from throat, from lungs, okay, from stomach, okay, from bowels, from uterus. Okay, from uterus it will be like metrorrhagia. Okay, or there can be vicarious menstruation, or there can be traumatic epistaxis. Okay, so hemorrhage is present. Now marasmus and other wasting diseases of children, also in bracket abrotanum, iodum, sanicula and tuberculinum. Okay, so we have read in abrotanum, but there nowhere acetic acid was mentioned, but now in acetic acid you can see bracket, in bracket abrotanum is given. So you should know that along with abrotanum, acetic acid is also useful also useful for marasmus and other wasting diseases of children. So in acetic acid, relation is given abrotanum, iodum, sanicula and tuberculinum, but in abrotanum nowhere relation to acetic acid was given. Next is great prostration. Prostration means weakness. So great prostration when? After injuries. Okay, after any type of injuries, if there is great prostration. Also the remedy bracket sulfuric acid. After surgical shock means after any type of surgery, or after anesthetics. After surgery means after anesthesia, both can be taken. Okay, so there will be great prostration. If person is having great weakness, great prostration, and the reason for that prostration is any sort of injury. Surgery is also one sort of injury only because of the incision. Okay, so after any sort of injury, after surgical shock, or after anesthetics. In all these three, if there is prostration, acetic acid can be given. And great prostration after injuries, this line also is in sulfuric acid. So sulfuric acid can also be used for great prostration. Okay, see again acid. So mostly acid have this prostration. Weakness is the prominent feature of any acid. Then important of acetic acid is thirst. What kind of thirst is acetic acid having? It is intense and burning. All acids usually have this intense and unquenchable thirst. So there is intense and burning insatiable even for large quantities when in dropsy. What do you mean by dropsy? Dropsy is actually old term which is used for edema. So now we call it edema. It is dropsy. So thirst is intense, burning, insatiable even for large quantities in dropsy, in diabetes, in chronic diarrhea. Okay. So these are the common where this insatiable thirst is present. In diarrhea, the common feature is frequent thirst. In chronic diarrhea also thirst can be present, but the twist here is that but no thirst in fever. Fever is such a condition where patient should, because of heat, patient should feel very much thirsty. So always in heat thirst is present, but in acetic acid thirst is absent in fever. So patient will be thirsty when he is having diabetes, when he is having chronic diarrhea, if he is having edema or dropsy, but there will be no thirst in fever. Okay. So this is important point you should remember. This point is very important related to acetic acid. MCQ can be asked directly from here. Okay. So no thirst in fever and intense burning insatiable thirst in dropsy, in chronic diarrhea and in diabetes. Okay. Now next is sore, belching and vomiting of pregnancy, burning water breath and profuse salivation day and night. This is MCQ. Profuse salivation day and night, in bracket lactic acid. Now if salivation is aggravated at night, the remedy is Merck salt. Okay. So Merck salt is the remedy when salivation is present only at night or get aggravated at night, but when salivation is present day and night both, then acetic acid and lactic acid both are the remedies. Okay, so but this line is given under acetic acid. To MCQ, if the question comes as MCQ that profuse salivation day and night, then the answer should be acetic acid. Okay, then diarrhea. How diarrhea? Diarrhea is copious, it is exhausting, it is with great thirst, in dropsy, in typhus. When will be diarrhea? Diarrhea will be in dropsy, in typhus, in phthisis with night sweat. Okay. Then true croak, hissing respiration, cough with the inhalation, bracket spongia and last stages. So you got it. How will be the diarrhea? Diarrhea will be very copious. It will be very exhausting, like patient will be very exhausted, very much prostrated after diarrhea, and in diarrhea there will be great thirst. And diarrhea can be during dropsy, during typhus, during phthisis, and there will be night sweat along with diarrhea. So these are the features of diarrhea in acetic acid. It will be copious, it will be exhausting, it will be after typhus, after phthisis, okay, after dropsy, and there will be night sweat along with diarrhea. So yeah, then true croak, hissing respiration, and cough with the inhalation. What will happen? There will croup is upper respiratory tract. Any kind of upper respiratory tract infection is called as croup. Okay, there will be hissing respiration with the sound wheezing and all will be present, and there will be cough with inhalation. When you inhale, you take in air, and you exhale, you give it out. So when you inhale, there will be cough. Inhale करते ही खांसी शुरू हो जाएगी. Okay, bracket spongia. तो same feature is also present in spongia tosta. And this remedy acetic acid can be used in the croup cases of croup and last stages. Okay, in last stages this remedy is very useful. So inhalation of vapor of cider vinegar has been successfully used in croup and malignant diphtheria. diphtheria. So earlier it was saying, like, not as a homeopathic medicine, but earlier when it was given, if this cider vinegar, not acetic acid, the cider vinegar directly when given the vapor to the patient who were having this croup, or so it was useful. This inhalation of vapor of cider vinegar was useful in the cases of this croup and malignant diphtheria. So means acetic acid can also be used in cases of croup and malignant diphtheria. Okay. Now next question related to MCQ is, cannot sleep lying on the back. So patient, even if he is having back pain, backache, he is not able to sleep lying on back. Okay, जैसे normally हम लोग सोते हैं वैसे patient को सोना पसंद नहीं आता, even if he is having pain in his back. And opposite to that is arsenic. Arsenic sleeps better on back. If arsenic person, the sleep position of arsenic and acetic acid is opposite. Okay, remember this. Acetic acid, this is arsenic that is lying on back. This is arsenic lying on back, and this is acetic acid lying on belly. So cannot sleep lying on back is acetic acid, and sleep better by lying on back is arsenicum. Now sensation of sinking in abdomen which causes dyspnea. Causing dyspnea. Now rest better lying on belly. Lying on belly यानी पेट पर जब सोते हैं तो patient feels better. Another remedy with same symptom is ammonium carb. So ammonium carb also feels better when he lies on his belly, on his abdomen. Okay. So lies better by lying on belly is acetic acid and ammonium carb, and better by lying on back is arsenicum album. Also ruta is there, but for now remember arsenicum album. Okay. Now hectic fever. In fever what happens? Skin will be dry and hot, and there will be red spot on left cheek, and drenching night sweat will be there. So skin will be dry and hot, and there will be red spot on left cheek, and there will be night sweat. Drenching night sweat. What do you mean by drenching night sweat? It will be profuse night sweat. So that is all important. Now relationship. This is important. Question is directly asked from relationship of acetic acid. So what it is? It antidote the anesthetic vapors, also amylosum, fumes of charcoal and gas. It antidotes opium and stramonium. So you should remember this. This is very important. The antidote, how this acetic acid antidotes anesthetic vapors, as we have seen here. If there is great prostration after anesthetic, acetic acid can be used. So same way it antidotes anesthetic vapor, fumes of charcoal and gas. Another remedy for same use is amylosum, and it antidotes opium and stramonium. Okay, and cider vinegar antidotes carbolic acid. So you should remember antidote. First important relationship is antidote. So acetic acid antidotes anesthetic vapor, number 1, fumes of charcoal, gas, opium, stramonium and carbolic acid. So 6, it antidotes 6 different this. So anesthetic vapor, fumes of charcoal, gas, opium, stramonium and carbolic acid. So this is the important relationship. Question is asked directly from this. And it follows well. Follows well means after which medicine acetic acid can be given is, it follows well after cinchona in hemorrhage. If there is hemorrhage, any kind of hemorrhage, and cinchona was already given, and if it has acted or partially acted, and after that we can give acetic acid, so it will complete that action. Okay, so it follows well cinchona in hemorrhage, and after digitalis in dropsy, if there was any kind of dropsy or edema, and for that digitalis was given, so after digitalis this acetic acid can be given. It follows well, and it aggravates the symptom of arnica, belladonna, lachesis, murk, especially the headache from belladonna. This last line is very important. Question is asked directly from this MCQ. Especially the headache from belladonna. It aggravates the headache from belladonna. So these are the relationship of acetic acid. So what all things you should remember about acetic acid? Number one, what is the common name? Who is the prover? What is the formula? And which class it belongs? And if that class, in that class, whether it is soluble in alcohol or water. You should remember this very well. It is 5A and not 6A. So 6A is soluble in alcohol and 5A is soluble in water. So acetic acid is easily soluble in water. Okay, so these basic things, that acetic acid, it is a cider vinegar. The common name is glacial acetic acid. It was proved by Barrage, but it was introduced by Herring. The formula is C4H3O3, and it belongs to class 5A, which is easily soluble in water. Okay, the patient is pale, lean with flabby muscle. Okay, number one, with face is very pale and waxy. Then there can be hemorrhage from all the outlets and marasmus and other wasting disease. Then there will be prostration. Prostration is important. Prostration after injuries, after surgical shock, and after anesthesia. And there will be thirst. Thirst will be intense, burning, insatiable in diabetes, in dropsy, and in chronic diarrhea, but there will be no thirst in fever. And after that there will be salivation, profuse salivation day and night, and only salivation aggravated at night is Merck salt. Then there will be copious diarrhea, which will be exhausting with great thirst, and there will be true croak, and with cough with inhalation. And after that, what was important? Cannot sleep lying on back. This is important. Sleeps better lying on back is arsenic, and sleeps better on abdomen or belly is acetic acid. And there is drenching night sweat during fever, and no thirst during fever. It antidotes charcoal, gas, fumes of charcoal, gas, or anesthetic vapor, opium, stramonium, and carbolic acid. It follows well after cinchona in hemorrhage, and after digitalis in dropsy, and yeah, it aggravates symptoms of arnica, belladonna, lachesis, and Merck. So that was all about acetic acid. Not much, few questions are asked directly as MCQ. Important is thirst, the sleep position, and prostration, the causes of prostration, and the face is pale and waxy. This is important. So few points only you should remember related to acetic acid if you are preparing for any competitive exam. Relationship is most important, so you should remember relationship, and in that especially remember the antidote, what all medicines are antidoted by acetic acid. Remember that very well. And a few things are given in success. Important symptoms from Borix Materia Medica. Let's read it. Although we are doing Allen's Keynote, but let's read it. Acetic acid. So acetic acid has the power to liquefy albuminous and fibrinous deposit, epithelial cancer, internally and locally it can be used in epithelial cancer. Now psychosis with nodules and formation in the joints. Hard canker, the 1X solution will soften and cause formation of pus. Anemia of the nursing mother. Irritable, worried about business affairs. Violent burning pain in stomach and chest, followed by coldness of skin and cold sweat on forehead. Stomach feels as if she had taken a lot of vinegar. Pain in back, relief only by lying on abdomen. Diminished sensibility of the surface of body. Acetic acid is antidotal to all anesthetic vapor. Counteract sausage poisoning. Not to be repeated too often except in croak. Okay. So this important few lines are given from Boric in success. So you should remember this, that it can be used in epithelial cancer both internally and locally. And if given in heart cancer, it will soften it. and it is used in anemia when the mother is nursing. If the lady is nursing and if her HB levels go down, if she is anemic, then acetic acid can be given. Then the person is irritable and he is worried about business affairs. Then there is pain in stomach and chest, and it will be followed by coldness of skin and cold sweat on forehead. And pain in back, this is important, pain in back which is relieved by lying on abdomen. And it is antidotal to all anesthetic vapor, and it should not be repeated too often except in crop. Such line can be asked directly as MCQ also. So not to be repeated too often except in crow. Okay, so these are the few lines given in boric materia medica. Okay, so yeah, and what else? Antidotes I have already told you: inimical, arnica, belladonna, lachesis and moxol. And nothing much, I think. Yeah, so that was all about acetic acid today. If you have any doubt or any question, you can ask. Yeah, that was all. You can ask any question or doubt if you have. We have finished reading acetic acid from Alan's Keynote. And if there is no doubt or any question, we can proceed to solving MCQs. First 25 MCQs we have solved that day. And I don't know how many of you still remember the answer, or how many of you have read that again. So if anyone would like to answer. Okay, so whoever attending this live session, not only attending but listening very carefully, should answer this question. Desire to be let alone, wants to lie down and sleep. Options are A. Gelsemium, B. Capsicum, C. Sulfur and D. Selenium, without looking into book. Okay, if I can expect answer from any one of you. Desire to be let alone, wants to lie down and sleep. Option A. Gelsemium, option B. Capsicum, option C. Sulfur, D. Selenium. Let's see if you all are attentive. No cheating. If you don't know the answer, you can say I don't know. Ajay Kumar, okay. Anyone else? Okay, so good try, but answer is capsicum. Okay, so such thing happens that usually questions are asked which are not very common, as I said last time also. When you think that this is the most correct answer, or sleep or sleepiness, drowsiness, this is related mostly to gelsemium, so we jump to answer it as gelsemium or think that gelsemium can be answer, but this exact line is given under capsicum in Allen's Keynote. Okay, you can go and check. So the answer is capsicum. Okay, so I don't know if this is helpful to you or not, like solving MCQ, or only we should read materia medica part. Okay, quickly let me know so we can proceed further to solving MCQ, or we can end the session. So we should solve MCQ, or it's fine only with materia medica. Okay, thank you. So next, last time we have solved first 25 MCQs from Ellen's, based on Ellen's keynote, and I'm expecting that you all will revise it again, so you will be able to answer correctly. Yeah, so you will be able to answer correctly next time. So we are proceeding with another 25 MCQs. Okay, the first one is skin. Vesicular erysipelas, vesicles all over body which are sore and suppurating. Options are petroleum, rustox, cantharis and graphitis. Yeah, okay. So yeah, so when in skin, vesicles all over body which are sore and suppurating. Option A petroleum, B rustox, C cantharis and D graphitis. So which is the answer? Correct answer. Correct answer is cantharis. Okay. Then which is vegetable analog of phosphorus? So you should remember this. No, it is cantharis. So that is what I am saying. Yeah, that is what I am saying. When you vesicles, when you are reading about vesicles, skin, so we tend to jump, like graphitis is for skin. So we think, yeah, it may be related to graphitis only, because in option graphitis is given and question is related to some skin condition. But such thing happens, the most confusing options are given. So this exact line is given under cantharis in Allen's keynote. You can check, and when you are solving MCQ, just go and check in a book. Don't just mug that what you call answer key. You should go and check and then see whether it is correct, not whether it is given or not. So cantharis, under cantharis you can see skin vesicle on page number 81 in Allen's keynote. You can see first line, skin vesicular erysipelas, vesicle all over body which are sore and suppurating. So this exact line, we know cantharis for for urine, for burning and all these symptoms. So that is how the questions are framed in competitive exams. So next is vegetable analog of phosphorus. You should remember this one chart is given in this success. Analog, vegetable and chemical analog. So just read that and try to remember it, because questions are directly asked from there. Yeah, good Aishwarya. LMCPA is the answer for that. So this one analog table is given. Just read it carefully and try to remember it by heart. Okay, so you should remember all the analog. So analog of phosphorus is LMCPA, right, Aishwarya? Okay, so some other analogs are vegetable. Dulcamera is kali sulf, cinchona ferrum metallicum, chamomilla magnesia phos, magphos, mesareum mercurius, ignatia natramure, LMCPA phosphorus, phytolacca kali iode, valeriana platina, podophyllum plumbum met, ipecac cuprum met, pulsatilla calimute. So for all those who don't know what does analog means two different remedies from two different kingdoms. As we said, one vegetable kingdom, one mineral kingdom. So vegetable analog and chemical analog. So one medicine is from vegetable and another one is from chemical or mineral, and but both have somewhat similarity. Both have similarity in action, both have similarity in their symptoms. So but both are similar but belongs to two different kingdoms. So that is called as analog of each other. So when you read analog, like the symptoms of dulcamera and kali sulf are somewhat similar, but dulcamera is plant and kali sulf is a mineral. So that is different. So you should remember the analog. Few analogs has been given by different authors. So you should remember this, that the analog of pulsatilla is kali mule. But this is again confusing because some says it is kali sulf. But then for exam purpose, for to make it easier, kali mule has been accepted as the analog of pulsatilla. Okay. So this is important. This table you should learn. Okay. So next is weak and exhausted from some deep-seated dyscrasia and no other symptom. So what is the answer? Option A, sulfuric acid. Option B, sulfur. Option C, sorinum. Answer option D, all of the above. Weak and exhausted from some deep-seated dyscrasia and no other symptom. Sulfuric acid, sulfur, sorinum. Answer is all of this. Okay, all of this. Sulfuric acid, sulfur and sorinum, all three have this symptom. Sensation of great coldness in head. In head, if you are feeling there is great coldness, the answer is valeriana. So you should remember other sepia veratrum album. Where is coldness in veratrum album and where is coldness in sepia? So just see veratrum album. In veratrum album, same symptom is given, but the sentence is different. That in veratrum album, there is sensation of a lump of ice on vertex. Patient feels that there is a lump of ice on vertex. Okay, that sentence is given under veratrum album, and this exact sentence is sensation of great coldness in head is in valeriana. And then what is in sepia? In sepia, coldness of the vertex with headache. There will be headache and then there will be coldness of vertex. So all three remedies, they select all the remedies which to be included into options which has some more somewhat very near symptoms given. Okay, so you can see in sepia the symptom, the line given is coldness of the vertex with headache. Two words are very similar in all these three remedies, coldness and vertex or head. So in sepia there is coldness of the vertex with headache. Okay. Then in veratrum album there is sensation as if a lump of ice on the vertex, and in valeriana there is sensation of great coldness in head. So this is the difference. But to answer our MCQ here, the answer is valeriana. The next is toothache while nursing the child. If there is toothache, when the patient nurses the child, the remedy is cinchona officinalis. But like as I said, you should know what is the symptom of toothache in chamomilla, in coffea and also in mercurius. So this is the task. Whenever you solve any MCQ, you should know the difference between, you should be able to rule out other option. So toothache while nursing the child is chamomilla, coffea and mercurius. Then great aversion to being alone are all except. So you should not be in a hurry to answer, read it very properly. Great aversion to being alone are all except. Like they are asking कि सब में इन सब में aversion होता है अकेले रहने का एक को छोड़कर. So नक्सवामिका, कालिका, लाइको and arsenic. So you should know कालिका, लाइको and arsenic are some remedies which desire company. So there will be aversion to company is only one, Nakswamika. Okay. So great aversion to being alone are all except Nakswamika is the answer. Okay. Now pains are ameliorated by coughing, walking or changing position. Arsenicum album, bryonia, apis and rustox. Answer is apis mellifica. Constantly loses the thread of conversation. This is very important in practice also. जब कोई patient कुछ बोलता है, whenever the patient is narrating symptom or whenever even you are talking to your friend, relative or anyone, and when they say they are talking to you and then suddenly they forget what they were talking about and they ask क्या बोल रही थी मैं और what I was saying, When such thing happen, that means loses the thread of conversation. They forget what they were saying. So that means that constantly loses the thread of conversation. The only remedy is medorinum. Okay, so medorinum is a very good remedy when patient has such symptom. Okay, then follows bryonia and ranunculus bulbosus. Well, now this answer you should all be giving. Follows bryonia and ranunculus bulbosus well in pleurisy and has cured after aconite and bryonia fail. No options to be given. Tell me answer. Quickly. Follows bryonia and ranunculus bulbosus well in pleurisy and has cure after aconite and bryonia fail. Aishwarya, no. Yeah, Ranjit Kumar, right. Yes, right. Okay, so one person has given right answer. So yeah, day before yesterday only we read about abrotanum in relationship. We read about this exact line. I told, even that time I told you MCQs is framed on this relationship part. See, you should be very attentive. So, and you see exactly, not they have missed that middle part, and they have directly written it has cured after aconite and bryonia failed. So that way they frame the question to confuse you. So follows bryonia and ranunculus bulbosus well in pleurisy and has cured after aconite and bryonia fail. Answer is abrotanum. Let's check. So what can be the answer? Is it right? Abrotanum, or it's centum tart? It's Carboanimalis calibicromium, or is it Sabadilla? What is the answer? Okay, so after aconite and bryonia in pleurisy, okay, relationship, in relationship it was given after aconite and bryonia in pleurisy when a pressing sensation remains in affected site impending respiration. So aconite and bryonia in pleurisy. Aconite and bryonia in pleurisy is abrotanum, and bryonia and ranunculus bulbosus is sabadilla. Okay, so answer is sabadilla. So both are in pleurisy, but bryonia is present in both this sentence, but with bryonia with ranunculus bulbosus is sabadilla, and bryonia with aconite is abrotanum. Okay, so this is a basic difference. Remember this, don't get confused. Okay, so bryonia and aconite is abrotanum, but in question bryonia and ranunculus bulbosus has been asked, so answer is sabadilla. Okay, so such thing happen, and we after seeing such question we get excited that yes, we know the answer, but then you should read it very carefully, read it twice, check all the options and then answer. Okay, next, it antidote poisoning with rust, stings of insect. Anacardium, ammonium carb, ledum or sepia. Answer is ammonium carb. Must change position frequently, but it is painful and gives little relief. Answer is natrum sulph. When arsenic has been improperly given or too often repeated in typhoid or typhus, answer is bacteria. Neuralgic burning pain after zona. Answer mesarium. Neuralgic burning pain after zona is mesarium. Desire various kinds of food but cannot eat them, become repugnant. Rheum is the answer. And longing for acids and pickles is an anti-crude. Okay, so okay, let's take more. Urticaria, acute or chronic over whole body, especially after violent exercise, is seen in all except is seen in natramure, is seen in heparsal, and is seen in sanicula. So except answer is sulfur. So urticaria, acute or chronic over whole body, especially after violent exercise, is seen in all except sulfur. Lack of confidence in himself and other is anacardium. So read other option like lycopodium, platina and lichen. All have lack of confidence, but some has only in himself, okay, some has only in other, but anacardium is the remedy who has lack of confidence in himself and also in other. Okay, now everything in the room seems strange, as though in a strange place. Okay, so this is in tuberculinum. In tuberculinum, everything in the room seems strange, as though in a strange place. And what happens in medorinum? So I'll just see and tell you that where it is. Yeah, everything in the room seems strange, as though in a strange place. The answer is tuberculinum. Abdomen enormously distended after meal is nux mosquita. Complaints of imaginary odor before the nose, as of herring or musk, is agnus castus. Has to strain at stool in order to urinate is alumina. And weakness and trembling of extremities of hands while writing during menses is zincum metallicum. Okay. Nervous weakness as if done up after much hard work is staphysagria. Thinks she is pregnant or will soon be delivered is veratrum album. Same symptom is in sabadilla also. See here the question is thinks she is pregnant or will soon be delivered is veratrum album, and same sentence in sabadilla will be like, wait, illusion she is pregnant when merely distended from flatus. Okay, so when merely distended from flatus, if there is illusion that she is pregnant when merely distended from flatus, this is in sabadilla. And in veratrum album it is thinks she is pregnant or will soon be delivered. And last is leucorrhea of children from atony is millefolium. Okay, so from tomorrow we'll do that. When we are solving MCQ, we should be able to rule out the other. So because same very similar options are given, so we should know leucorrhea of children from atony is given in millefolium, but we should know how is the leucorrhea of, yeah, that's what I was saying. You tell me how can it be done, Dr. Ranjit? So I should be asking you question, but you people are not replying. Like only you and one other were there who were answering. So when you are reading about leucorrhea, you should know, how is leucorrhea of millefolium, how is leucorrhea of colophyllum, sepia, natramure, and all. So you should be in a position to differentiate, to rule out the options, so to find out the correct MCQ or correct answer to the question. So for that, as I said last time, that the therapeutics, comparative study is very useful. So from tomorrow we'll be doing the same, and I'll help you to differentiate all the remedies from each other. So if you have any other suggestion, you people also can give me. And yeah, like I told said last time, that it is not a classroom session that I'll be only saying and you people are listening. It should be more of an interactive session. It should be sort of discussion where I will be able to know what difficulties you have and how I should proceed to give you more, help you more. What are the areas where you people are facing problem. So if I know all these things, I can help you better, and I can try to do this live session in that way. So feedback is really very important. Suggestions are very important. So that's what I'm expecting from you all. If you can suggest, and yeah, there is a Telegram channel I have created. So please do join, and there you can give your suggestion, your feedback, and then we can discuss which in which part you all are facing difficulty. And other than materia medica also, if you want me to take live session in discussion on any particular subject, any particular topic, we can do that as well. So but you should let me know, so then only I would be in a position to understand. For all those for all AI PGT aspirants, you have enough time, but it should not be wasted. Use it very wisely, and these sessions will be really helpful to you all. So just don't miss it. Ask your friends also to join, do discussion, and just hard work, no other option you people have. If you want to take admission in really good college, you want to take admission and do MD in your desired subject, then hard work is only key, consistency is only key. So be consistent, do hard work, and be attentive. So let me know, give your feedback. Yeah, yeah, we'll discuss it tomorrow, Dr. Ajay. So MCV accordingly. Okay. Yeah, sure, Dr. Ranjit. So please join that Telegram group, and that is only purpose for communicating with you people. Because some if some are what I should say, some are messaging DM on this Instagram in comments, or some are doing mail and all. So there should be one platform where everyone, all of us, can give our opinion, suggestion, feedback, and at one place. Healing with Heena, same. Healing with Heena. Everywhere, same name, no other. Healing with Heena in Telegram group, same name. So please do join, and please do let me know. I'll see you all tomorrow. Thank you so much. Okay, so anyone have any question or anything to say, or we should wind it up? So yeah. Okay, so that's all for today. Thank you so much for joining. See you. Take care. Bye. Good night.